Hi, Christopher. Just before you get discharged today, I wanted to provide you with some quick information on osteoporosis because I know that's something that's going on right now for you. So here's this little pamphlet that you'll be able to take home, but I'm just going to go over it really quickly with you. So as you already have known from this visit, osteoporosis is just this condition where you have these two types of cells in your body, and one of them builds bone and one of them breaks down bone. And so in osteoporosis, this type of cell that breaks down bone is much more active than the type of cell that's building bone. And a lot of people consider this a women's disease because it's very common with menopause due to the lack of hormones like estrogen, but this also happens a lot in men. Like 1 in 12 men over the age of 55 also suffer from osteoporosis, so you're not alone in this. And so I know that you've been having some trouble in your knees, and so this pamphlet actually specifically focuses on the knees because that's a very common weight-bearing joint. And so basically the way your knee works is it's like a ball sitting in a socket, so kind of like a cup, and that allows it to rotate. So if this is from your femur and then it sits into a socket made out of your tibia and fibula, and so then this is able to rotate and your knee is able to bend, but because of that, the knee joint carries a lot of weight when you move and when you walk. And so if the bone becomes porous, so basically when those cells break down a lot of bone, big holes form in the bone, and that causes it to be less strong. And that causes a lot of pain in the joint area because of breakdown of bone and cartilage, which lines that ball and socket joint I just showed you. And so there are a couple of things that you can do that will actually slow down the progression of your osteoporosis. So first, vitamin D is super important. And as you know, the seasons are changing, and so it's like really gloomy outside now. And we don't get as much natural sunlight, which is our most common way to absorb vitamin D. So what you can do is actually do a lot of dietary things. There are some foods that are really rich in vitamin D. And so you can eat more red meat or dairy or oily fish like salmon, or you could even take vitamin D in a vitamin supplement form. So that can be a tablet that you chew or you swallow whole. There's a lot of different forms that you can get over the counter just about anywhere. And vitamin D is super important because it helps you absorb or digest calcium, and calcium is very important for helping those cells that I told you about earlier that build bone. It helps them stimulate more bone growth in your body, which takes away from the bone resorption that's happening. And then the second thing you can do that's really important is engage in weight-bearing exercise. And so one type that's really, really easy to engage in wherever you go is yoga. And so in here there's 6 poses that you can do, and that they target the joints that are most at risk, so namely your knees and your spine, since those bear a lot of the weight in your body. And yoga is super easy because you can do it virtually anywhere, and so these will give you instructions on how to do those. Yeah, so perfect. So here are those for you, and then there's some other just fun facts in here, and there's a quick summary telling you things you can do, things you can eat, and also it's important to avoid smoking and alcohol. That will also just help in general with your bone absorption. So I can give this to you and you can head on your way.
Thank you.